John, a 72-year-old retired teacher from Florida, always considered himself financially savvy. He paid off his mortgage, saved diligently, and believed his Medicare coverage was a comprehensive safety net. Then, the first year of his unexpected long-term care needs presented a bill totaling over $35,000. Over just a few years, these costs accumulated, revealing a potential out-of-pocket expense that could easily reach $150. Eroding decades of careful retirement planning. This wasn't a one-time emergency. It was the slow burn of uncovered health expenses. It's a stark reality many retirees face. Shin 2. This situation is far from unique. Data from the Fidelity Retiree Healthcare Cost Estimate reveals that an average 65-year-old couple retiring today can expect to spend $315,000 on healthcare throughout retirement, even with Medicare coverage. A significant portion of this, often underestimated, comes from services Medicare simply doesn't cover. Another report from the Kaiser Family Foundation highlights that out-of-pocket spending on medical care for Medicare beneficiaries reached an average of $6,150 in 2018, often higher for those with chronic conditions. This demonstrates a systemic gap in financial protection. Most people understand Medicare provides essential coverage, Part A for hospital stays and Part B for doctor visits and outpatient services. It's a foundational element of retirement security. However, thinking Medicare covers everything medical is a common and costly misconception. The program is designed to cover acute, medically necessary care, not every health-related expense you might encounter over a potentially long health span. This distinction is crucial for financial planning, especially as our lifespans extend. One significant area of uncovered costs lies in prescription drugs. Medicare Part D helps, but it has deductibles, co-pays, and the infamous coverage gap, or donut hole, where beneficiaries pay a higher percentage of their drug costs. Even after the donut hole, there's a small percentage you'll still pay. For individuals managing multiple chronic conditions, the cumulative cost of medications can easily run into thousands of dollars annually. These predictable, yet often overlooked, expenses quietly erode retirement savings. Another layer of complexity involves choosing between Original Medicare and Medicare Advantage plans. Original Medicare typically leaves you responsible for 20% of Part B costs with no annual out-of-pocket maximum, prompting many to purchase a Medigap policy. These supplemental plans fill the gaps but come with their own premiums. Medicare Advantage plans, offered by private insurers, often include prescription drug coverage and may have lower premiums, but they can come with network restrictions, co-pays, and variable out-of-pocket limits that need careful consideration. The largest financial blind spot for many retirees is long-term care. This is where costs like John's $150,000 potential bill originate. Medicare does not cover custodial care, daily assistance with activities like bathing, dressing, or eating, whether provided at home or in a nursing facility. This type of care, often needed for years, can cost tens of thousands annually without dedicated planning. These expenses can quickly deplete life savings, affecting not only the individual, but also their family's financial stability. To bridge these gaps, the first actionable step involves a realistic self-assessment. Consider your family health history, your current health status, and your lifestyle. Do you have conditions that might require extensive medications or future assistance? Are you factoring in potential cognitive decline or mobility issues that often require long-term support? Understanding your personal risk profile provides a clearer picture of potential future healthcare expenses beyond basic Medicare. Next, explore strategies to cover long-term care. Options include traditional long-term care insurance, which can protect assets from these potentially devastating costs. Hybrid life insurance policies with long-term care riders are also gaining popularity, offering a death benefit if care isn't needed. For those with substantial assets, self-funding or utilizing a health savings account, HSA, specifically for retirement medical expenses can be viable. Education on these financial instruments is key to making an informed choice. Shin 9. Many mistakenly believe these issues are too complex to tackle. Proactive planning secures your health and financial future. Beyond insurance, investing in your health span actively reduces future medical burdens. Maintaining a healthy weight, regular physical activity, and a balanced diet can prevent or delay the onset of chronic diseases, directly reducing prescription drug needs and the likelihood of needing extensive care later. This bioeconomic connection means that lifestyle choices today serve as powerful long-term investments in your financial well-being. Thinking about biological age, not just chronological age, opens new avenues for financial longevity. Finally, remember to review your healthcare coverage annually. Medicare plans, especially Advantage plans, can change their benefits, networks, and costs each year. The annual enrollment period is your opportunity to compare options, ensure your chosen plan still meets your needs, and adjust for any new medications or health conditions. Staying informed and proactive about your healthcare coverage is a critical, ongoing aspect of sound financial management in retirement. Scene 12. The potential for significant out-of-pocket medical expenses is a reality for many entering their later years. Understanding these dynamics empowers you to shape a more secure and vibrant later life. For John, the $150,000 realization was a hard lesson. He adjusted his investment strategy to account for higher medical reserves, explored state assistance programs for long-term care, and began reviewing his Medigap policy more critically. His story isn't one of despair, but of awakening to the complexities of longevity financing. He found peace not in perfect solutions, but in informed adaptation, highlighting that financial wellness in later life requires continuous learning and proactive engagement.